Good morning. Thank you. Thank you, Arnau. Now we're going to explain our experience, our first experience that we've had with the use of 3D prototyping for complex surgical oncology cases. So in recent years, you all know there's been an increasing number of reports in the use of 3D modeling for teaching, for diagnosis, for surgical planning, and for bone reconstructions. Using 3D printing for bony structures, we've seen that on the previous presentation, is quite straightforward. And therefore, most of the publications that you'll find on the internet are based on cases of cranial and maxillofacial surgery and orthopedics. However, there's fewer experiences are being described about soft tissue surgical planning for 3D printing. So the surgery for solid tumors sometimes can be very straightforward. You won't expect many surgical complications. But as opposed to that, other surgeries can be very challenging, very demanding, and very difficult. This is the case, for example, of neuroblastoma. Neuroblastoma is a solid tumor that it's one of the most common in the pediatric ages, and it tends to locate in the abdomen. This neuroblastoma, what it makes is encases major vessels and affects the surrounding organs that are vital. In those cases, a gross total resection, which means removing most of the tumor, more than 90% of it, has an impact, as you can see on these graphics, on the overall survival of the kid, and also on the probability of local progression. So, having in consideration all these issues, we asked ourselves, can we assure, when we perform a surgery, a gross total resection? Can we do better? Can we foresee the complications? Can we plan the surgery? Can we actually operate the tumor before the real surgery? So with all these questions in mind, and with the experience of our colleagues, the maxillofacial surgeons, we envision the objective of having printed a complex surgical oncology cases with all its anatomical relationships for the surgical planning. So to do that, we selected very complex patients with complex tumors. And the radiologist, the surgeon, and the engineer review the routine CT and MRI images in order to delineate the tumor, the surrounding structures, the vessels, and the organs. And with that, a virtual 3D model was built. And from that virtual model, we printed, and Felipe Fenollosa will give you more details on the technological aspects of that. We printed actually the physical 3D model. Here you can have a summary of the 4 cases that we had. You have here the diagnosis, the imaging, the approach that we use, if we had any complications, and the outcome. Here on the following slides, you'll see the virtual reconstruction of the tumor. You can see the organs like the kidneys, main vessels, and we navigate through this virtual reconstruction. And here, we actually are taking out the tumor without taking any risk at all. And then here, we envision if we take all the tumor out. That's good for the surgical planning, and that's available in many hospitals around the world. But we wanted to go a step further. We actually wanted to have the tumor and the relationships printed. So we can take a look at the tumor and the anatomical relations from each angle, touch it, work with it, discuss it with the team, and eventually do this. Can we put the video in? If it works. Well, actually, this short video shows one of the things that we envision, that is dissecting here and removing the tumor before the real surgery. Here we have the left kidney and the left vessels of the kidney. And on the next video, the next slide, please. It's similar to that one, and what we are rehearsing here is taking piecemeal a neuroblastoma that is encasing the superior mesenteric artery and the aorta and the inferior vena cava. So at the day of the surgery, we brought the models to the OR. They were sterilized, so we could check at them at any time. And if we encounter any difficulties or we're doubting, we could check it anytime we wanted because they were sterilized, as I said. And then here on the left side, you can see the surgical field with the main specimen removed. And then on the blue area, you can see other part of the tumor that was encasing the major vessels and that had to be removed, as I show you on the video, piecemeal. And on this other picture of the surgical field, besides having the tumor printed, I mean the models printed, we also wanted to have the tumor itself. So we could correlate if the tumor removed on the surgical area correlate with the tumor that we printed. So based on this experience, we published a recent article that is published in the World Journal of Surgery. And what can we conclude? So having a tumor physically printed in different components of the anatomy and its relationships is feasible, and Felipe will talk about that. And those refinements in the surgical planning can help achieve greater and safer resections. And in this early experience with the 3D prototyping, it helped for the surgical oncology planning. Obviously, as you are aware, we have limitations. This is not perfect. This is not the perfect thing because we still spend a lot of time building the models. The materials, as you see, there are still limitations on that and the cost. But obviously, 3D printing is here to stay for surgical planning. That's obvious. We have the experience of the maxillofacial surgeons for over 10 years from that. So this is here to stay. And for that, we have to improve materials, gain elasticity, so at the end we can mimic the human anatomy, which will be the goal. So the surgery that we performed before will be almost as the surgery that we perform in the future. Thank you very much.